Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, President Rodrigo Duterte approves the distribution of ayuda in Metro Manila amid the implementation of the Enhanced Community Quarantine, or ECQ. As cases continue to rise, Health Secretary Francisco Duque admits the effects of Delta COVID-19 are now being felt in the country. And what else can be done to prepare for Delta COVID-19 surge? Health Spokesperson and Undersecretary Rosario Vergeire joins us live. President Rodrigo Duterte has approved the distribution of aid or ayuda to 80% of Metro Manila's qualified population. Metro Manila will shift to the enhanced community quarantine beginning August 6th, the strictest form of lockdown. Meantime, the president assures fair distribution of COVID-19 vaccines nationwide amid the threat of the Delta COVID-19 variant. He also admits that vaccine donations from the United States was part of his decision to stop the termination of the Visiting Forces Agreement, or VFA. Here's the president in his own words.
Pasalamat tayo sa kanila at maibigay naman may naibigay na naman ako sa kanila na konsesyon. I consider the continuance of 2D continuance of the Visiting Forces Agreement. In gratitude, I said, mahirap. Nagpapasalamat tayo. I'd like to thank President of the United States, Biden, the government and the people of America for not forgetting us. Kailangan natin na dahan-dahan lang. Yung una natin yung mga mainit na lugar. Tapos, as the supplies come in, it will be distributed to all of the local government units, including the far-flung areas na hindi na maabot.
Health Secretary Francisco Duque says the effects of Delta COVID-19 variant are now being felt nationwide. Duque says the number of cases has been steadily increasing. The DOH has yet to declare community transmission of the Delta variant, pending more evidence, but urges everyone to act as if there's one. Let's go straight to the source of this story. We have Health Spokesperson and Undersecretary Rosario Vergeire. Usec, Vergeire, welcome back to the source, and thank you again for your time.
Good morning po, magandang umaga po sa inyo.
So till now, Usec, will you say hindi pa nagde-declare ang DOH ng community transmission of the Delta COVID-19 variant?
Yes, ma'am. No? So as we always say, there is this definition coming from WHO for community transmission. Kailangan po namin ng evidence so that we can be able to officially pronounce that there is community transmission. We have to remember there are international implications when you declare a community transmission. But what we are doing right now is that we assume there is community transmission already because we are seeing this. So sans any evidence right now, we are going to do actions towards this direction that there is already community transmission.
And I read the siguro qualifications, if you may call it, of what a community transmission would be. It would be clusters from multiple areas that are supposed to be not interconnected. Tama ho ba, Usec?
Yes, that's right, ma'am. No? So when we define community transmission, this would be that there are no known or evidenced linkages anymore from the different individuals with this, for example, Delta variant. Hindi na po natin makita kung saan yung source, hindi na natin makita kung sino yung may mga relationships across the different individuals with the variant. And also, nakikita na natin talaga yung pagkalat ng kaso. So for now, we are seeing that there is this increase in the number of cases. We are seeing also that it is happening already in most of our regions. But still, our whole genome sequencing kasi cannot provide us that evidence yet. That's why we cannot officially pronounce. Although, as I've said, we now treat this as community transmission and we are acting towards that direction.
Frankly, how important is it for you, Undersecretary, to declare a community transmission. I mean, importante pa ho ba yun? O yung sinasabi niyong gumalaw na lang tayo as if merong community transmission?
Yes, ma'am. No, so that's important. No, this official pronouncement, because as I've said, there's international implications. Ang atin pong WHO, they classify countries as to low, moderate, and high risk based on the levels of community transmission or based on the levels of transmission. So ang community transmission po, ito po yung pinakamataas na level where the transmission happens in a country. And most of the time, countries will use WHO classification for their restrictions in their country. So kailangan meron ho tayong appropriate evidence when we say there is community transmission. But as I've said, I will then reiterate, we are now gearing towards this direction. We assume now there is community transmission.
Yun nga po yung gusto kong tanongin. Is it inevitable, this community transmission of the Delta variant, considering that the cases are rising?
I think so, no? So that is our assumption because of the high transmissibility of this Delta variant, and also because looking at our cases right now, it's exponentially rising. So sa tingin ho namin talaga, Delta variant is driving the rise in the number of cases. But of course, there are still other variants, not to consider the Alpha and the Beta variants, which were also detected in most of the regions in the country.
Let's look at the projection, and I want to understand the numbers, if you don't mind, Undersecretary. The projection of FASTER and the autumn group to which the DOH had referred to, kasi this can cause some concern, no? They're saying that, and I hope you can clarify this, 18,000 to 30,000 active cases in Metro Manila by end of September, even with lockdowns. Ang sinasabi po ng dalawang grupo, kahit na dito sa 1 week na GCQ with high 10 plus additional and 2 weeks na ECQ, we are looking at at least 18,000 active cases to 30,000 active cases only in Metro Manila by the end of September. And for context, right now we have about what? 12,000 or 13,000 active cases.
Yes, ma'am. Currently here in Metro Manila, we have active cases of about 13,000. And based from the projections coming from this platform of FASTER and Autumn, they have initially projected that we will have about 18,000 active cases when we have this 4 weeks ECQ, and we will have about 30,000 active cases if we will have 4 weeks of GCQ. But I just like to inform the public that these projections were initial projections based on the baseline that we've had last week. So as the cases increase right now, these projections will be increasing as well. That's why we're working on new projections, because these were based on the last week's projection and the last week's proportion of these variants in the country.
Does that mean it's going to be higher than 18,000 to 30,000 active cases?
Yes, ma'am. It may increase because of these new projections, and also we are now factoring in some of the things that are happening right now. So based from what we are seeing right now, our average number of cases have already increased. Last week, the average number of cases nationally was just about 5,000 to 6,000. Now we are averaging almost 7,000 to 8,000. So with this increase in the number of cases, we can see that our projections will also change.
Ano po yung projection na nakikita nyo right now?
Hindi pa ho natin natatapos yung projections, but definitely, if we are going to, let me just explain this. No? So these projections would tell us how many number of active cases we will have by the end of September 30. But people has to remember that even if we do community quarantine restrictions, cases will still rise. But what we are expecting and the objective would be, even if cases rise, we can be able to reduce hospitalizations and the severity of the disease through vaccination. Kaya isa po sa strategy natin ngayon, ira-ramp up ang pagbabakuna kahit po tayo ay naka-restrict or naka-ECQ, so that we can have more people protected from the severity of this disease and eventually hospitalization.
You talked about severity of the disease. This is something I wanted to discuss with you, something I also discussed with Secretary Duque. If we just focus on NCR right now, last week we averaged about 1,800 cases here in Metro Manila. Ano po? I was looking at the healthcare system because that's what we need to focus on, one of the major concerns, especially the ICU beds. If we put that up on the screen right now, our ICU bed capacity, 55% are used. Ibig sabihin, sa NCR po, meron tayong 1,100 beds available. 55% ay utilized na. So that leaves us about more or less 500 beds na natitira pa kasi 600 beds pong gamit na. Kapag po kasi 1,700 cases tayo sa NCR and then ang severe at critical natin is 1.2 and 2.1, that's about 3.3%. Parang lumalabas po, Usec, magkakaroon po tayo ng about 50 patients na severe and critical every day. Would that be a correct assumption?
Well, that is also how we do this thing simply, no? Parang back of tissue paper estimation when we do our discussions, no? So when we try to look at our, for example, you have 1,000 cases and severe and critical will be averaging about 4% of these 1,000 cases, then you'll be seeing this number of people who will need hospital beds. So based on the projections that we have, these initial projections, this 18, we had 18 to 30. If you look at the 30,000 active cases and you remove 4% of these 30,000 active cases, you'll find that you'd need about this number of 1,200 ICU beds for these individuals with severe and critical. But we need to remember also that a person, for example, I am a severe patient, I will take 21 days in the hospital. If I am a moderate patient, I will take about 14 days only. So these are sliding, and you would see that the number of beds that you would need would increase because of this requirement for each individual to stay in that hospital for that length of time.
Totoo po. So kung balikan ko po yung ginawa kong calculation, kung nasa 1,700 tayo a day, dito po sa Metro Manila muna, so we try to simplify the calculation, and 3 to 4% are critical and severe who will need ICU beds. Again, I'll go back to that 50 patients a day. That means in 10 days, ubos na po yung...
So, is that concerning? Because if that is right, in 10 days, all those ICU beds will be full. Because matagal din po yung turnover ng mga pasyente.
Yes, ma'am. No? So, pwedeng initial assumption. I'm sorry, I'm having gaps with my internet. But basically, what I'm trying to say would be that we compute that the same way, but also there are other factors that we consider when we do our projection. So, it is not really just the basic that 4% and then how many cases right now, that is how we compute, because we have to consider the other factors, as I've said, like the length of time that a patient stays in a hospital when you are severe and critical. But what we are doing right now is that we are trying to project more of what we think would be needed, because we know that it can rise, the requirements may increase, and not just 4%, we are anticipating that so that we can be able to prepare more and we are ready when that time happens.
Okay, we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. Our guest today, health spokesperson Maria Rosario Vergeire. We have been having problems with our internet connection. So there are times that hindi ko po marinig yung sagot ni Usec at hindi rin po marinig ni Usec yung mga tanong ko. So in summary, what I was trying to say, Usec, is that if my calculation is correct, in 10 days, yung ICU beds natin right now, no, at 1,100 beds could be full, could be filled. That could pose a big problem if my math is right, Usec, no? What are the plans? Because 10 days is a very short time.
Yes, ma'am. No? So the plans would be really to ramp up and to expand our hospital beds. So currently, we are waiting for these 4 big hospitals in Metro Manila to open their expanded ICU beds. We are expecting about more than 200 beds in these 4 major hospitals. This is Lung Center of the Philippines, National Center for Mental Health. We have the Quirino Memorial Medical Center and the East Avenue Medical Center. Aside from that, the Secretary already instructed that all hospitals should be in their surge capacity already. So that means that public hospitals should be able to expand as much as 50% of their beds for COVID, and for private hospitals to expand as much as 30% of their COVID beds. What would be most important also right now is our navigation of our patients. We have to remember that in the past increase in the number of cases in the country, we saw that people cannot access because most of those admitted in hospitals were mild and asymptomatic patients. So we are now trying to activate our navigation systems, our telemedicine providers. Our local governments are expected to establish their triaging system so that we can be able to avoid overwhelming our hospitals again because of this improper referral and improper navigation of patients.
Dapat ho, right now, Usec, do you agree that dapat na nating paghandaan ang worst case scenario?
Trying to plan and anticipate for the worst case scenario. That's why all levels of government offices had been mobilized already and activated. Lahat po ng kailangang tulong ay atin kinukuha na po natin so that we can be able to prepare for the worst. So yung worst case scenario po ang tinitignan natin, kaya po tayo talaga ay nakikipag-usap araw-araw sa mga operational people natin so that we will be able to ensure that at the very least we'll be able to manage, especially those severe and critical cases.
Undersecretary, I'm not sure if this is a simplified question, but I wanted to hear your thoughts on this. What is a number you're seeing? Kasi right now, we have been recording over 8,000 the past 4 days, if I'm not mistaken, 8,000 cases nationwide. What is a number you think that makes it very critical already?
For now, I will consider that our numbers are basically, it's 8,000, it's 7,000. When we look at our previous numbers, when we were having the increase in cases last March and April, we were seeing about 10,000 to 11,000 cases. That was the peak of the increase in cases last March and April. But as everybody says, our experts are saying, and experiences from other countries have shown us, it can double, and it can even triple. In the projections, for these initial projections, there was this number that they gave. If we are going to continue on and we will not have this kind of restrictions, we can reach up to 500,000 active cases by the end of September.
Yeah, I read that, and to be frank, I got very nervous with that 500,000 estimate. But let's qualify that kung hindi tayo nag-lockdown, Usec. Kasi ang dami na pong numbers na lumalabas. And to be frank, sometimes it becomes very confusing already.
Yes, ma'am. So let's qualify that. That 500,000 would be if we will continue to just have the GCQ with heightened restrictions, here in NCR. And yun po yung projection. We'll reach 500,000 by the end of September. But the projections, if we will be able to impose ito pong sinasabing GCQ with heightened and then 3 weeks of ECQ continuous, we will have about 30,000 plus cases or active cases by the end of September. But if we will impose 4 weeks of ECQ, we will have about 18,000. So that's the range.
Right.
But we are looking at, yes ma'am, gusto lang namin sabihin ulit, I like to reiterate, these are initial projections based on the numbers last week. So this will still change and we will inform you.
Pwedeng papalit-palit po yan. And in fact, it can get worse because last week, cases were still down. Hindi ho ba? At pataas po yung mga kaso ngayon. So that can change. And if it changes, from my understanding, it can go higher. However, we also don't know the kind of effect really of this ECQ. And very important is the vaccination, which I'd like to talk to you, but we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Health Spokesperson and Undersecretary Maria Rosario Vergeire. Usec, is there any projection on ramping up vaccination again in NCR? Because hiningi po ng mga mayors, ng NCR mayors ang 4 million, government committed to giving this 4 million. And I think the target is to be able to do about 250,000 vaccinations per day. How big of a help or contribution will this be in preventing the further spread of the virus?
Well, this will be a very big contribution, ma'am, no? Because we see that vaccines work and vaccines can prevent severe infections and hospitalization. So like what I've said a while ago, we expect that even if we do this hard lockdowns, we will still see the numbers increasing until the end of September maybe. But our objective and our hope will be, because we are going to ramp up vaccination, that we will be seeing less numbers of number of cases that will be classified as severe and be going to the hospitals. So that is our main goal, that we can still preserve our health system, that we can be able to reduce the number of those with severe infections and eventually being hospitalized and dying.
But with one dose, for example, ano po, that's not enough, hindi ho ba? I mean, you can only have so many antibodies. That's why worldwide and experts keep saying you need to finish 2 doses. And if we were to look at those people who will get their first vaccination, it will take another 30 days before they get their second vaccination. So, ano pong epekto nito? Kasi hindi naman po after one vaccination, you get completely no one is completely protected. Pero syempre, ang protection mo mas mataas kapag dalawa na yung bakuna mo, which is an interval of 30 days.
Tama po yan, ano? So that's part of our calculations and part of our estimations on how we are going to do the response. We have to remember first, tama po kayo, yung sinabi nyo, na based on evidence, you need 2 doses to get yourself fully protected, no? And when you have your 1 dose, there is still some protection, but you still need really 2 doses to fight this Delta variant. Second, hindi lang po bakuna ang aasahan natin. No? It's not really just the vaccinations that we are going to rely on when we battle this Delta variant. We need to ramp up our PDITR response. At yan po yung pinapagawa natin sa lahat ngayon, that there should be active case finding, shorten the time from detection to isolation so that we can cut the transmission. We should be testing so that we can detect people, immediately isolate them, and we can contain the spread in their areas.
And can we get an update on the Delta cases?
We still have not received the new results for this run. We were able to run 350 samples over the weekend, and we still need to receive the results from the Philippine Genome Center.
Weekly yan, no, Usec, yung results from the Genome Center?
750 every week. We have this machine right now which runs 350, and that is what we are using so that it's going to be faster. But we have the 750 machine that is set to start also testing by this week as well.
Areas of concern, we had focused our discussion on NCR, especially with the active cases and the vaccination. What are the other areas of concern? Because if you look at yung po sa balita at even sa social media, ilang mga ospital na rin po sa Cebu ay puno na. You can actually see patients lining up and even cars at pati po mga ambulansya.
Yes, ma'am. No? So we are seeing different areas in the country na tumaas na talaga yung cases. And we are seeing that hospitals are getting this rise in the number of admissions. Pero pag tinignan ho kasi natin, when we try to analyze the data. In these certain areas where we see in social media, like in Chongwa daw yan, apparently, na may mga ganitong klase na mga pasyente na nasa labas na. Pero yung public big hospitals natin dun sa area ay meron pang capacity. So ang ginawa na po ng ating regional director ng DOH dyan, together with our undersecretary there, na inaayos na po nila yung referrals para po mailipat natin dun sa ibang ospital pa na libre yung mga pasyenteng nasa labas ng ospital na yan.
Inaayos na yung referral, but wasn't that supposed to have been done much earlier?
They were all hospitals actually. Nung pumuputok na po yung sa India na mga kaso, they were asked to prepare already. But sometimes kasi po, meron talagang certain capacity lang ang isang ospital and the expansion is really hard for them. So with this, ang nire-relyan natin would be the referral system that we have. So there should be this appropriate referral navigation system so that we can preserve at hindi natin mapapayagang mapuno ang isang ospital sa isang lugar.
And one other concern that you had mentioned a while ago, you said increase in capacity. I believe you said 50% sa public hospitals and 30% sa private hospitals. Here comes the other problem, Undersecretary. Kakulangan ng mga healthcare workers. Is this being addressed now?
Yes, that's true. No, so that's part of the challenge for the government, because once you expand your capacity in beds in your hospitals, you would need the different components for this bed. And that will include the healthcare workers. That's why we are continuously hiring these healthcare workers. You were able to hire already about 4,100 nurses and has been deployed to hospitals and other facilities of the country. We have hired medical specialists. We have hired doctors, general practitioners, so that they can also supplement our hospitals. So this is what we are really trying to work on right now, that the healthcare workers would be preserved and that we can be able to hire some more.
Health Undersecretary Maria Rosario Vergeire, ma'am, thank you so much and take care of yourself.
Thank you.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.